Hello, my name is April Zeoli, and I'm going to talk about modeling the movement of homicide by type to inform public health prevention efforts. Now, when I say the movement of homicide, what I'm talking about is the idea that homicide might diffuse through communities. Diffusion is the systematic change in the spatial distribution of a phenomenon over time. It's not random movement. Now, if homicide diffuses through communities, we should be able to detect that movement. The idea that homicide might diffuse through communities has been around for about 30 years, and there are factors that support the hypothesis that homicide diffuses. For example, there are mechanisms that facilitate homicide that may spread through social and subcultural processes. For example, increased proliferation of firearms in communities. As residents in those communities perceive that many others in the community have firearms, those residents may acquire firearms for protection or as a status symbol. The availability of firearms in a community may increase the risk of lethal violence. There may also be a greater willingness to use lethal violence for protection or to save face in a community where not doing so may be dangerous. Violence and homicide can also be used as a mechanism of social control when wrongs that need to be redressed cannot involve the formal legal system, or the legal system is not viewed as being able to help. Finally, homicide may be used as a retaliation for past wrongs, including avenging other homicides. But homicide is not a unitary offense. There are different types of homicides, which are characterized by unique situational factors. This variation is due to the fact that homicide can be better characterized as an outcome of various types of specific crime, for example, robbery, drug dealing, or intimate partner violence, instead of one specific type of crime or event. So it may be that only certain types of homicide diffuse. Certainly the mechanisms of diffusion I just listed seem to apply better to gang-motivated homicide, for example, than to intimate partner homicide. So we conducted an analysis to examine which types of homicide, if any, showed patterns of diffusion from 1997 through 2007 in Newark, New Jersey. Newark is located in northern New Jersey. It is 24 square miles, and in 2007, it had about 277,000 people. 53% of residents are Black, and 31% identify as Hispanic, and 24% of families are below the poverty line. Now, Newark's homicide rate is also much higher than the national average. At times, it's been 4 times higher than the national average. So we were granted access to the Newark Police Department Homicide Investigative Unit investigation files, from which we gathered data on homicides. There were 560 homicides from 1997 through 2007, for which law enforcement had gathered enough information for us to assign a motive. We assigned 7 different motives. The first 2, intimate partner homicide and non-intimate familial homicide, were characterized by the relationship between the victim and the suspect. Drug-motivated homicides were those that occurred as a result of the sales or distribution of illegal drugs. Gang-motivated homicides were directly related to furthering the economic, social, or territorial interests of the gang, and that included internal conflicts within a gang. Homicides that resulted from an argument or physical altercation that immediately escalated into lethal violence were termed escalating dispute homicides, while revenge homicides occurred as a result of the victim or the offender intending to retaliate for a past event. Finally, robbery homicides resulted from an incident in which the offender attempted to take or successfully took money or material possessions from the victim. Now here are homicide counts by type in Newark from 1997 through 2007. The dark purple shading on the bars are firearm homicides, and the light purple shading is non-firearm homicides. Over 70% of overall homicides in Newark during this time were committed with firearms. Familial and intimate partner homicides were the only two groups in which less than 50%, less than the majority of the homicides were committed with firearms. As an aside, this makes Newark very different from the nation, in which over 50% of intimate partner homicides are committed with firearms. We used a data-driven approach to identify our at-risk population for homicide. For example, the gang-motivated homicide group that was at highest risk was Black males aged 15 to 34 years old. We used cluster detection software to detect spatial temporal clusters of homicide using the unit of analysis of the census tract month, which gave us 12,690 units to work with. The scans for clusters determined whether the observed number of homicides within the scan was greater than the expected number of homicides within the scan. And we only present those clusters for which the significance level was less than 0.05. Of our 7 homicide types, 2, intimate partner homicide and robbery homicide, did not cluster. So these types of homicides definitely did not show a pattern of diffusion by census tract month. Non-intimate familial and escalating dispute homicides did cluster. You can see the red and orange clusters are non-intimate familial, and the blue and green clusters are escalating dispute homicides. Despite clustering, the clusters are not adjacent. They're not adjacent in space or in time. So there's no real pattern of movement here. For example, the non-intimate familial homicides, those two clusters are separated by 5 years. And the escalating dispute homicide clusters are separated by roughly 3 years and a lot of geographic space. When we get to drug-related homicides, we see that the two clusters are adjacent, but again, they are separated in space by over 2 years, so there's no discernible pattern of diffusion here. The red drug-related homicide cluster, cluster 1, was from December 1997 to May 2000, and there were 9 homicides when less than 1 was expected. Cluster 2 was from November 2002 to September 2007, and there were 13 homicides when 1.9 was expected. Now, notice where those clusters are. Remember them for the next slide. Because we're going to see here, for revenge homicides, that those drug-motivated homicide clusters line up with the orange revenge homicide cluster in space. There are 2 revenge homicide clusters. The red one is from March 1999 to March 2004, and it included 20 homicides, where only 2.29 were expected. And cluster 2 was from March 2005 to July 2006, and included 11 homicides, where again less than 1 was expected. Now, these clusters are separated by space and time, so again, no real suggestion of diffusion. The gang-motivated homicide clusters are the only ones that showed signs of diffusion, with a clockwise movement through Newark. Now, there are 4 contiguous clusters that move through time from July 2002 through December 2005. The red and yellow clusters begin in July 2002, but the red cluster only lasts 1 month, whereas the yellow cluster lasts through May 2005. In May 2005, the orange cluster emerges. The green cluster provides the geographic link between the yellow and orange clusters and coincides in time with the yellow cluster, but ends before the orange cluster begins. Now, not only is this interesting because it shows a pattern of diffusion, and is arguably the most likely type of homicide to diffuse, given what we surmise about factors that would facilitate diffusion. But let's look at this map next to the revenge homicide cluster map. So both the orange and red revenge homicide clusters take up some of the same space and time as gang homicide clusters. Additionally, if we were to put the drug-related homicide cluster map up, we would see that the orange revenge homicide cluster inhabits much of the same space and time as the orange drug homicide cluster. such as this in November 2005. You can see that the drug-motivated, gang-related, and revenge homicide clusters all inhabit that space by the western arm of Newark. So what does this mean for prevention? Well, given that we have overlapping areas of different types of cluster, revenge, drug, and gang-motivated clusters, it suggests that there are subcultural mechanisms or facilitating factors that are giving rise to multiple different kinds of homicide within that space and time. And if we could focus on those facilitating factors or subcultural mechanisms, then we may be able to reduce homicide. Now, gang-involved individuals were involved in 25 to 43% of homicides for escalating dispute, robbery, drug, and revenge homicide categories. So potentially focusing on gang-involved individuals and gang activities would result in a decrease in homicide. Now, this is not news. There are interventions now that are showing some success at reducing homicide and violence in gang-involved individuals and youth homicide and violence. So those types of interventions can be targeted more in space and time potentially to really get at this movement of homicide and clustering of homicide. But not all types of homicide diffused or even clustered. So prevention efforts for some types of homicide, for example, robbery or intimate partner homicide, may need to be widespread in time and space and really focus on potential facilitating mechanisms, while these more targeted approaches may be justified in other types of homicide. For more information, please read our article in the American Journal of Public Health. Thank you very much.